Good?
Good?
So you can come here. Come here.
Right.
Okay. All right. So now, this is one instrument. We have different instruments we can use. This is one that's a clinical instrument. Let me see.
It's tied?
Yeah, I think I just
Okay.
need to leave this part.
Okay.
Dr. Campbell, I have seen such magnificent changes of just changing the breathing pattern in a person with one before and then repeating the exam. Percentages going up, you know, like 60% higher just
Right.
by breathing.
Yeah.
In terms of oxygen, neurotransmitters, everything.
Yeah. I think the biggest thing is that people don't believe that it can happen. And so that's why I think that's one of the biggest powers of this is just that it shows them that it's
You
working.
can measure it.
Yeah. So once they believe it, then they're more likely that they'll do it. So you just put this around your waist. So now you can just sit just normally for a couple of minutes. And I'm just going to talk a little bit about this. So here, this is showing the heart rate. This red line or pink. The blue is showing the breathing. Okay, so we're just going to watch it for a little while. Down here, this is what we where we show the heart rate variability measures, the very low frequency, and high frequency. Right now, we're not getting any measurement there because it takes 64 seconds to gather enough data in order to give a report on the variability between the heartbeats. So once we have 64 seconds of data, then it will start to show the readings down here for the heart rate variability. Here we're seeing the heart rate, and you can see it's changing. This is showing the breaths per minute. So now, have you practiced diaphragmatic breathing or anything like that?
I am a yoga teacher.
She's a yoga teacher, so see that makes sense where I was seeing 7 breaths a minute.
Yes.
For many people that don't practice breathing, you would see 15 to 20 breaths a minute. If you could just connect somebody and you don't tell them anything about slow breathing, and you just say, okay, I'm going to just record for 2 minutes, and you watch their breathing, it would probably be about 15 to 20 breaths a minute. Now, as a person practices, they start to slow their breathing down like this, and you can see when she inhales, this blue line goes up. When she exhales, it goes down. And sometimes, you'll start to see this line following the blue line. So that's what we talked about before with the RSA, or the respiratory sinus arrhythmia, to see the pattern where the heart rate is following the breathing. So when she inhales, the heart rate speeds up. When she exhales, it slows down. Sometimes it's not perfect, but as she gets into more relaxed and calm and just doing the breathing and feels more relaxed, and I'm not talking about her, then she would start to get more of a pattern where the heart rate is following the breathing. This is a pacer, so we can have the person follow this with their breathing. So when it's going down, they're breathing out, exhaling, and when it's going up, they inhale. So breathing in, now breathing out, down. And you start to see the pattern where it's following. And when we have the better pattern of the variability, this comes on, because the low frequency is going up, the very low frequency and high frequency are going down. So that's showing the balance of the autonomic system, the sympathetic and parasympathetic. When it's more balanced, then you will see that pattern. You see how much it's following now? That's better. And you just have the people practice doing this type of training. So you can see where if this can make more effect on a person than if you just tell them to breathe slow. They can see what they're doing, and they can see the effect that it's having on the nervous system.
So that's 5 for is the the beats per minute? I mean,
This
the
is
respirations
breaths per minute, how fast, yes.
5, that's really,
Yeah.
you're doing that much?
Well, she's a yoga teacher.
Or you're
So she
I've
practices.
been doing yoga 20 years.
No,
so-
but right now, you are just
I
fine,
know
you're
how to-
trying to do like consciously breathing?
It's
or?
natural, and yeah, because I'm still doing my diaphragm breathing.
Okay, but what if you just breathe naturally without conscious breathing, like when you're meditating or something? How would it be?
Is that going to?
Yeah,
Let's,
breathe.
well, let's,
Try
No,
to
well,
breathe.
I'm saying, let's say if you were working, or if you're
Exactly.
on the phone, or just doing something not purposely relaxing,
Exactly.
with your breathing would probably speed up a little bit.
maybe, but maybe not.
My experience with people that
Yes.
practice the slow breathing, like in yoga or
It's part of my
meditation,
life.
that they do it so much that their average breathing is slower than the rest of us.
Exactly.
So if the average person is 15 to 20 breaths a minute, maybe they're not at 5, but maybe they're at 8 or 9.
No, my question
Or
comes
10.
because if she's doing like that breathing right now, that rhythmic
Yeah.
breathing, you're gonna get a different result than
Well,
if
I think what
she were
happens-
breathing naturally.
Well, see, that's the thing. I think what happens is once we're talking about breathing, someone who practices it, it's hard for them to not do it.
All right.
Exactly, but if you, maybe you can use the other guy and see,
The
and
difference,
compare the
We could try it, we could
Yeah,
try it.
because I'm a perfect
But you
example.
didn't finish your, but what? I thought you were gonna finish the.
No, it's fine, it's fine.
All right.
Okay, so this is our subject number 2. Let's see what we get here. So here you can see, take a look at this now, the breathing. See?
Yeah.
All right. All right, so now you see this pattern here. So this is inhale, exhale. So that's faster breathing.
Shallow.
So now just see if you can follow this with your breathing. Follow it so when you
That
breathe.
means a shallow respiration?
Yes. Just keep following that pacer. Inhaling, exhaling. Now you see? Now he's down the same. But the normal pattern was faster. And you can see, just in a short amount of time, he was able to make the shift.
Sonó el teléfono.
Se desconcentra.
It's
So you
on
see
the
again?
phone and everything
See?
get disrupted.
See, now when he's not thinking about it again, he goes back to fast.
Look what happens when the mobile rings, Mira, you get crazy.
So you can see the pattern just totally changes when you're not focused on it and following the slower pace. So now if you follow the pacer again, you'll see this number will drop back down again.
Okay.
Okay, I want to go more with this part, but I have to just finish you can stay hooked up. I just want to go through the rest of this. You can still hear the breathing, right? So this is just continuing with this. So the biofeedback technology has the role of training by giving the person immediate measurable evidence of the changes that are going on when they change their breathing and how it affects the nervous system. So everybody knows that what their heart is doing is important. So if I can show somebody that by changing their breathing, they're having an effect on their heart, then I usually will get their attention. And they will listen and practice what we're teaching them. According to this article, there's significant evidence that heart rate variability biofeedback is an effective intervention for a number of physical and medical conditions. Here it suggests a possible mechanism of heart rate variability biofeedback is the restoring of autonomic balance or homeostasis. And this autonomic balance may be the common cause in improving various symptoms that are often caused by or made worse by stress reaction. The condition of asthma involves a person having difficulty breathing because of narrowing of the air passages. Heart rate variability biofeedback can help with this in two ways. First, the client practices breathing deeply and efficiently. So what happens is they learn to move more air with less effort. So even if she was breathing at 6 breaths a minute or 5 breaths a minute, she was getting enough air, no problem. But a person that's having an asthma attack, they feel, even if they're getting enough air, they feel like they're not. And they get nervous, which makes it worse. And then they tense their muscles up, which makes it worse. But if they can learn to move more air with less work, instead of doing this, then they will have more confidence that they're going to have enough air. And they don't feel right away that it's emergency, that they have to get their pump or they have to go to the emergency room. Maybe they just say, okay, let me calm down and do my deep breathing. And if they feel like they're getting enough air, maybe they get past where they feel it's an emergency. If it's still a problem, they can always get their pump or go to the doctor. But often they have less times where they have to resort to that. So just that gives the person more confidence that they're going to have enough air. But also, besides this part of it, the second way that it's helping is that it's getting them more calm and relaxed. And that will also have an effect because often stress can trigger the asthma attacks or make them worse. And so if they're stressed less often, it's going to be a trigger less often. So they can work through some of the early signs of a asthma attack by using their slow, deep breathing. And they keep their muscles relaxed, and it's less of a chance that they're going to have the problem. They feel like they're getting enough oxygen, and they don't have to worry. And it's happened very often that they have less trips to the emergency room, and they don't use the inhaler as much. Another thing that it can be helpful for is hypertension, as I mentioned before. Some of the earlier protocols for biofeedback for hypertension used EMG, surface EMG, and also temperature biofeedback. So it was a combination of relaxing muscles and also increasing the blood flow to the extremities, the fingers and the toes. And that helped also because it's turning off that stress reaction. But they're starting to find now that heart rate variability may be more effective than EMG and biofeedback. I'm sorry, EMG and temperature biofeedback. So now I would probably, if I had them available, I would use all of them, EMG, temperature, and heart rate variability. But often people don't have all of them available, and it might be easier to use heart rate variability because there tend to be less expensive ways of being able to do heart rate variability than, say, surface EMG. Another advantage with this is that it's mainly based on diaphragmatic breathing, and that can be practiced without any equipment outside of the clinic. So it makes it easier. Like you've been practicing most of the things that you do without any equipment, and it works. You can just turn it on at any time. So this effect of decreasing hypertension problems is related to the turning on of the barrel reflex, which regulates blood pressure. And the diaphragmatic breathing alone can help with that. Also, there are uses for anxiety and trauma symptoms. There's another name that you may have heard of, Bessel van der Kolk, and he did a lot of work related to PTSD, and I think The Body Remembers is one of the things that he wrote and things like that. And so it talks about how the body continues to react in the nervous system based on problems that happen or stressful events or trauma and so on. And so this is a way to help to release some of that energy, the stress energy from the body, and help with anxiety types of problems. Often, if you just breathe too fast, you can make yourself feel uncomfortable. So you can imagine a person that has tendencies towards anxiety or panic, and if they're breathing too fast, it can trigger anxiety or panic. So these are things that by teaching them the slow breathing and using the heart rate variability biofeedback, you can help them to reduce some of these symptoms. So it can be helpful to have people practice for long periods of time, but I also ask people to practice short periods of time. So many times in clinic, you tell people to do homework, and they say, oh, I don't have time to do 20 minutes of relaxation every day or every other day or anything. So I say, okay, well, what about when you're driving, if you're at a red light, you have to wait anyway. So just do some slow breathing until the light turns green, you know. Or if you're in the bank, in the line, and you just do some slow breathing until it's your turn. Or in the grocery. So there are times where you're doing nothing anyway, and before you pull out your phone and start doing your email and stuff, just do, even if it's 10 breaths. It can help to shift your mood and to shift what your nervous system is doing. Even for that short time, it can make a difference. Oh, this is another name that you would want to look up if you're interested in heart rate variability. Vasilio, it's a husband and wife from Russia. They did a lot of research on heart rate variability and a lot of the applications. Insomnia is another area that the heart rate variability biofeedback can help with. And even, again, just doing slow, deep breathing before a person goes to bed can often help them to sleep better. Sometimes in the clinic, when you're teaching the slow, deep breathing, you see people start to yawn and get sleepy. So you can see how it would help with insomnia. So part of what happens is the overall heart rate is slowing down, and so you can see, even though he's not seeing the feedback, you can still hear the effects. Are you breathing slow, or are you just breathing normal? Back and forth, slow. See, when you can hear that sound, that means he was doing better. It's very common for people who practice heart rate variability to become sleepy right in the middle of the session. And you know, so that can show you that it can help with sleep problems. There's more research needed in the area of insomnia to show, you know, even more that it is effective. But just from what I've seen so far, it's definitely an area that it's helpful for. So just to summarize, heart rate variability biofeedback is an effective tool for helping people with physical and mental problems, including asthma, anxiety, hypertension, and insomnia. And we also mentioned PTSD as well. So, you know, I think it's something that I would just want you to consider. If you do want any additional information on heart rate variability, biofeedback, you can contact me. Also, I can give you the full set of slides. And I do have a exhibit out there if you wanted to get more information on it. Any questions anybody has on the, do I have?
Yeah, of course.
Yeah. Any questions anybody has?
Does they have a variability between day and night, or day afternoon, or?
The differences between day and night? Well, there's going to tend to be some differences in what your body is doing in different times of the day, but it's something that can have an effect in any time. So if it's nighttime or it's daytime and you slow your breathing down, it's still going to have an effect to regulate your autonomic system.
Does the system shuts down itself when it finishes, or?
Well, it depends on how you have it set up. Like right now, I have it just to keep running. But I can
So-
set it to stop in 10 minutes or 5 minutes or 20 minutes.
If you stop right now, we don't get a reading in terms of the percentage of.
No, we can get a reading if I stop
I
it.
mean, if he's agreeing to share his results
Sure.
with, huh? It's okay?
No problem.
So if I stop here, this is showing all of the statistics that you can get. Let me just take these off for you so you feel free. So these are some of the things that, that you can look at here. We didn't have blood pressure connected, but you can see like the interbeat intervals. You can see the heart rate variability peak frequency. Here is 0.08. So a good number would be in that range of the low frequency. So 0.1 would be like right in the middle of it. But 0.08 is very close, so that's a good number. Then you have, this is one that I tend to look at. So you see the very low frequency, and high frequency, these percentages. Because low frequency is most associated with the good balance of the autonomic nervous system, you want that number to be the highest out of those three. And you can see that this one, the low frequency, is 54, and the others are 24 and 21, so that would be good. So if I saw, let's say that maybe the high frequency number was the highest number, then that wouldn't be as good, and then it would be more of an indication that it needs to do more training. And any other questions? So is anybody currently using heart rate variability?
Practice of my mindfulness
Uh-huh.
to improve the heart rate.
Sure. Yeah, I think because mindfulness is going to be having an effect on the autonomic system, it would improve the heart rate variability. I think, in fact, one of the things that you can do is if you have the technology, you can kind of research those things to see, let's say for instance, if someone is just in their normal state and they start to meditate or something like that, and you can look at the data and see if it has an effect. I mean, you can do studies. You know. So anyway, if there's no other questions, I want to thank everybody for coming and for your attention and for smiling and, and not throwing anything at me. Thank you.
Yeah. We want to thank you, Mr. Campbell. You know, on behalf of Navy University, we want to present you with this certificate so you can keep us.
Great.
And awesome.
Then I can
Take a
show my
picture?
wife that I actually was working, right? Thank you. Can you send me that?
Of course. Okay, I'm gonna pass your presentation to the.
Sure, sure.
Hay que llenarle la tarjeta.